An urgent call to support NHS workers amid the winter crisis.
Yeah, so as the NHS faces extreme pressure, Frontline 19, which is a non-profit organisation, has launched its Care in the Cold campaign. And this new initiative calls for urgent support to help meet the escalating demand for Frontline 19 services.
And with us now we have Samantha Wathen, Operating and Communications Officer for Frontline 19. Samantha, hi.
Hi.
Right, so tell us about this. I mean, I've read the support in papers for this, and it is something I think that maybe doesn't occur to people, that when there's pressure on the NHS, it's not just patients getting it in the neck, so to speak, is it? It's the staff themselves.
Yeah, absolutely. So, I mean, it's understandable that obviously a majority of patients or relatives, especially in that emergency situation, it's not going to be the forefront of their mind is obviously thinking about the staff, and we wouldn't expect that. But at the same time, it is a very real situation that these people are under, particularly at this time of year, and particularly with the understaffing and the underfunding that we've seen. It's created sort of like a perfect storm of really bad pressures for people. Mm. And, people are only human at the end of the day. They're trying to run departments where they're vastly understaffed. There's a tremendous amount of pressure in terms of the number of patients presenting. There's too much to cope with a lot of the time. And so people in these emergency departments especially are really facing the sort of moral injury that comes with having to deal with, things, but they haven't got enough resources to do so. So moral injury in particular is one of the things that we're seeing present with people an awful lot, and that defines where a member of staff is not able to deliver the level of care that the patient deserves and requires and that they're trained to give, because they're constrained by a lack of staff, a lack of resource, etc.
It must be an awful thing to feel, that you want to help and you're unable to because of circumstances.
Absolutely, and it's things like trying to deliver care in a corridor. A senior medic said to me the other day that you don't deliver care in a corridor, you deliver treatment. You can't care properly for somebody in the corridor. That is not how people were trained. It's not what people went in to do. And the issue now is we're losing people hand over fist because people just understandably cannot cope with this on a sustained day-to-day basis. It's just too much. It's actually really, really bad for people's mental health. And we're seeing kind of extremes of that presenting further, unfortunately.
So, Samantha, in practical terms, then, what do you actually do to help colleagues who are struggling?
We're run by a psychotherapist. Our CEO is a psychotherapist herself, and what we offer in the main is one-to-one counselling support by trained professionals on that one-to-one basis, up to 12 sessions in a virtual way for frontline members of staff. So some need the full 12, some don't need that many. It depends, obviously, what the person's presenting with. We also offer kind of some group work around particular areas, such as things like breaking bad news, or if, say, there's been a particularly traumatic incident occur in a department and a lot of the same team are affected, we'll guide people through those things as well. So it's a range of sort of counselling and psychological measures that we do offer.
So does this happen actually during the crises that we're going through, or is it after or before? Because I was thinking it must be quite difficult if people, staff are being pulled off their actual work in hospitals or wherever. How does it work?
So in terms of in a logistical way, we have sort of about a 6-week lead time, and we do triage people. So obviously the most urgent people obviously go first, depending on how they're presenting. And we do run sessions to fit in around the client as much as possible. Like I said, they are virtual, so they may happen straight after shift, they might happen in the lunchtime or whatever. Not that many people at the moment are getting any breaks, but to answer your question sort of quick, it probably won't happen kind of today, tomorrow, as it were. It will probably happen sort of 6 weeks on or whatever. And if the person is, particularly in a bad way, then there are other more urgent services potentially that they could access. But we do it within the kind of like a 6-week lead time, but we will triage people appropriately.
But they'll know that this is waiting for them when they have time to deal with it.
Yeah, absolutely. I mean, what we saw during COVID as well, that there was a little bit of a delay because it is just about that logistical fitting in with people. But at least people have accessed us. They've got on the system. They know that there is some support that is going to come their way in the near future. And that in itself is quite comforting to some people to know that there is that support out there. We are completely free for the user, and we are completely confidential as well. And that, particularly with this client group, healthcare workers in particular, always very, very nervous of kind of anybody finding out, any of the colleagues, because this isn't right, but it's just the view that a lot of them hold, is that they think, oh, if I'm found out, if I'm accessing this psychological support or counselling, I'm not up to my job, people are going to think I can't do my job properly, which we know it is rubbish, but it's legitimate concern in their heads, that often people think. And, we're completely confidential.
Just whilst we've got you, Samantha, tell us a bit more about Frontline 19, because you don't just get involved in winter crisis work, do you? You're helpful in across a variety of different interventions, I think. Is that right?
Yeah, I mean, we're kind of within the interventions that I mentioned, but we're certainly not around just for this. So we started off in 2020 as a response to the COVID pandemic. We started off by Claire Goodwin-C, who's our now CEO, and she's a psychotherapist herself. She basically thought, what can I do during COVID? Wanted to help just a handful of people, so I don't know, 50 people. It became a huge thing, basically, government involvement at the time. And now we've helped, not just NHS, but in all front lines, although we do concentrate these days on the NHS, approximately 1 million workers. And that is a mixture, like I say, of the one-to-one support, but also some group therapies and things like that as well. So we are around for all of UK, at the moment, frontline healthcare workers throughout the UK, the whole time. So, yes, certainly not just the winter crisis, but all the time.
Yeah, because if people aren't, okay themselves, they can't care for us. It's so important, isn't it? I mean, it's something that you tell people all the time when they're struggling with one thing and another. You have to look after yourself. You can't look after your mum or your kids or whatever. You can't be the helper. You can't be the carer if you don't care for yourself.
No, exactly. And you'd be surprised, I guess, how many people don't really think about that. And there's this whole kind of, mantra that historically that, particularly senior doctors, that they're almost not human, they're there to look after people and they don't get ill themselves. My doctor can't be ill. It's this kind of strange sort of psychological thing that exists.
How does that work?
Exactly.
Yeah.
But obviously people are human just like in any other job, and particularly the things that this client group are exposed to. It'd be weird if they didn't ever have a problem.
Yeah. It must be really hard for them, because they're seeing stuff that most of us would crumble under, and they also have this feeling that they can't, that's impossible for them.
Yeah, I mean, we're not just about treating the symptoms, but what we also want to do longer term is address kind of the ingrained stigma, really, in accessing support, both from the client user's perspective, but also from the public perspective. Yeah. And just kind of put out the fact that, this is very normal, people are human, and they just need support like anybody else. And it really needs to be embedded, really, in sort of like formal training and ongoing throughout the NHS at all levels, to make sure that people are supported right from medical student upwards, basically.
Yeah. Well, thanks for coming and talking to us about it. It's really, really interesting, and I hope people will, who are accessing care and accessing doctors and nurses and expecting to be helped, will maybe have a think about the fact that they are people too, as a result of this.